what that stands for. If you can see behind me, Massachusetts College of Pharmacy and Health Sciences is the oldest university in the city of Boston, 200 plus years going, and was one of the two oldest schools of pharmacy in the country. Harvard University, yes, the Harvard you're thinking of, the Harvard you know, the Harvard that when you're thinking of it, it's that one, the crimson and white. Their medical school was built across the street from our university, and they built Harvard Medical essentially around MCPHS. So our campus intertwines with Harvard Medical's university. So that provides some of the best internships and research that one can get while attending college. All of our students do their clinical rotations, internships, research through Harvard Medical and their teaching hospitals. And so kind of we branched off from pharmacy into everything medicine. I'm going to talk about medical majors. I'm going to use MCPHS because they have all of them. I'll talk a little bit about the school at the end. But certainly I'm going to go ahead and cover all medical majors, and we are going to rock and roll and do this. And let's do that. Okay. So a little bit about MCPHS. Medicine, when I came here in 2009, I'm sorry, my name is Alan Beaudoin. You can call me whatever title you want, Associate Director, West Coast Director of Admissions. I'm fine with all of that. All above, the bottom, in between, the whole 9 yards. You can, or you can just call me Alan. That's fine too. Most people do. I am the one who makes decisions on the applications out here. I review them. I'm a one-man band. I travel all over. I meet with students and parents at high schools and at college fairs and visits and presentations, and I make decisions on the applications. So certainly, I can help answer pretty much any question that you may have. About 200 years ago, I didn't come here. I wasn't born yet, but 200 years ago, as I said, the university opened its doors. I came here in 2009 when the housing market and auto industry crashed. And when that really happened, I noticed something very, very interesting. I noticed that medicine was in a bubble. Medicine oftentimes is in a bubble when there's a recession or a pandemic because it's the only thing still standing, because we need it. Do we need a Louis Vuitton? No. Would we like one? Yeah, but can we get by without it? Yes, we can. We can find a Michael Kors or something that's maybe even a little bit above Michael Kors, but still in the price range until the economy subsides and we presume with our normal lives. Would we like a Lamborghini or Ferrari? If we don't already have one, I'm sure some people want one. Can you live without it? You can, but you cannot live without your health because you can't do anything without your health. And so we always need healthcare practitioners. And so schools like MCPHS and medical professions are always going to be around and thriving. I learned something in the recession of 08 and 09 that we're in a bubble. Other college graduates at Ivy League universities, at big name universities, names and rankings that we're not having success because the economy crashed. But our pharmacists, our PA graduates, our nursing graduates, our students going on to med school and had graduated from med school, all of our graduates had high paying jobs despite what the state of the economy, because medicine is not affected by a stock market or a recession. Same last few years, our graduates were, and our enrollment goes up. And the school does very well in recessions and pandemics because we need these graduates. We actually provide medical degrees along with licenses, and our students are getting high-paying jobs in good times and bad. So, but that's the medical field in general. You're always going to need these people. We cannot live without them. They provide, without them, we don't have our health. So it's really incredibly important that we continue to provide quality service to everyone, and that we as an institution provide quality service, and certainly to our students so they can graduate and provide quality service. So when you're talking about medicine, it's, everybody just thinks about a doctor. And most of the time when they go in and they go in to see a doctor, what they're really seeing is a PA or a nurse practitioner. They're really not seeing, sometimes for just like a regular checkup, they're really not seeing a doctor. They're seeing, or a surgeon, they're seeing a nurse practitioner or a PA. With that being said, let's take a look at some of the programs here and we'll go through them. Give me one moment. Give me one moment here. Let me just briefly stop sharing and give me 1 second. Sorry about that. I had to fix my audio. My apologies. So let's presume back. And as we were, when you take a look at the medical field, it is vast. Like I said, sometimes we see a nurse practitioner, sometimes we see a physician's assistant. Um, what is in lately, in I would say within the past 6 years, the profession of a doctor of osteopathic medicine comes up. So what? Sometimes I'm often asked because a DO, AKA a DO, doctor of osteopathic medicine, uh, can they be an anesthesiologist? Can they be a surgeon? Can they be a pediatrician? They can. So, what is the difference? A doctor of osteopathic medicine focuses on the entire body, where the MD focuses on specific symptoms of the human body. And so, therefore, but in today's world, a DO is licensed the same as an MD. So, we have both programs. So students are always like, well, are the same opportunities available for a DO that there are an MD? Yes, of course, absolutely there is. Absolutely 100%. So they're both, licensed the same. They get paid the same. They're looked at the same. The difference is, I think you dive a little bit deeper as a DO than you do an MD, focusing on the entire body and what's going to cure that versus just the symptom. Um, Again, sometimes students ask me, well, I don't want to perform surgery. I want to do annual checkups on people so I can become a nurse practitioner or a physician's assistant, right? And I say, yes, you can. Basically, in the PA and coming out of high school, there are both programs. They're both a 6-year program. For MD and DO coming out of high school, those are 8-year programs. Not everybody has them. We're one of the few schools that do that combined undergrad to grad. And so with PA and nurse practitioner, those are 6-year programs. Certainly, you are basically most of the time, if I'm just traveling somewhere and I'm not at home seeing my regular doctor, I'm certainly, if I'm traveling, let's say in your area, because I live in Los Angeles in the Bay Area, or if I'm just anywhere in Seattle, if I'm in New York, and I'm not feeling well and I have got to see somebody, most of the times I'll stop off at a clinic and I'll see a nurse practitioner or a PA. And so that type of schooling, again, your PAs can perform, nurse practitioners can perform surgery under the supervision of an MD or DO. Again, coming out of high school, those are usually 6-year programs. There are 155 med schools in the country. There are only 20 or so optometry schools. So the eye doctor, they do very well. And just as well, if not better, than an MD or a DO or a surgeon or an anesthesiologist or plastic surgeons do really well, especially in cities like Los Angeles where looks are, movie stars in Hollywood. That's a different story, but but the eye doctor does do very, very well. They study the eye for like 7 years, and it's incredibly important. Without our vision, whether you're a pilot, world leader, president of the United States, president of Turkey, teacher, an engineer, no matter what one does in life, their vision is incredibly important. So the eye, there are 20, maybe I kind of shot the number under a little bit. Maybe there are 22, between 20 and 22, potentially 23 optometry schools. Were one of them. That is a 7-year program out of high school. So one that, because there are, if you think about it, there are a lot of people out there today that just aren't comfortable, like myself, getting LASIK eye surgery. Are there many successful ones? Of course. Are there more successful ones than not successful ones? Yes. However, the truth of the matter is there's still that small, slight potential that it could go bad. And with that being said, people like myself, I prefer my glasses and contact lenses, and there are a lot of people like me. So optometry, or what they call OD, is an incredible, incredible profession, lucrative, many job opportunities. I'd say maybe getting into optometry school might be harder than getting into med school, vet school, or dental school, simply because there just aren't as many optometry programs. So, and I'm happy for that because it's not saturated. Oftentimes, I love about our university is we don't saturate the program simply because We cannot. Um, if you look at pets, um, everybody's got a pet. And so I think a veterinarian today is doing better than they've ever done before. Getting into vet school is challenging. We have a program which is 8 years out of high school, but vet school is very challenging but highly rewarding. Certainly almost everybody today has a pet, so or wants one or will have one. So there are doggy daycares, there are doggy parks, especially in California, right? So definitely a veterinarian profession is fantastic. It's lucrative, and definitely a lot of job opportunities. But it is certainly challenging. But I wouldn't let that stop anybody. There are many job opportunities for dentists, just as much as there are vets in dental school. And so, during the pandemic, one of my close friends who's a dentist, she owns her practice. She thought she was going to go under, but don't you know that oral health is important and making sure your teeth and your gums, and then you don't allow plaque to build up and you don't allow gingivitis to get into your mouth, and that can create all kinds of complications. Dentists just don't clean people's teeth, give them caps or give them veneers or give them Invisalign or braces and make their pearly whites look gorgeous. They do that, but they also prevent disease from getting in and harming you. And not too long ago, there was a gentleman who had in his molar in the back, or his bicuspid, he was having some pain. The dentist's fault on this one. The dentist did not do as good a job as they should have, and there was an infection in the back of under the molar. And instead of draining it, getting the infection out, they capped it. They trapped the infection. The infection leaked into their heart and caused the patient to go into cardiac arrest, had a heart attack. They survived, but that can happen. So it's not just when you floss at night and when you brush your teeth and when you do all that, you're really preventing disease from getting into your mouth and causing oral cancer, things like that. So dentists, although most people, I'm not saying all of us on this Zoom call, in this presentation today, not all of us think of dentists as just fancy jewelers that make our teeth look good. They're actually important stewards of health as well, and making sure that, just like a surgeon does, just like whether it be an MD or a DO, whether it's a vet to an animal, removing cancer. Certainly an optometrist who checks for signs of cancer and all kinds of things. A dentist, oftentimes it gets caught up in people's smile, and your smile is important, but just as much as your smile is important is the fact that you've got to have your oral health. Some bad things can happen if we don't. So dentistry, of course, getting into dental school is challenging. And like all of these, when you look at MD, medical doctor of osteopathic medicine, again, they're licensed the same. And again, remember, a DO is an anesthesiologist, a pediatrician and a surgeon. Optometry and optometrist, and vet, MD, DO, vet, and dentistry. If you're someone who's super ambitious and you don't want to go to a UC or Cal State school and just get a traditional bachelor's degree, then apply to dental school, you can go into, there aren't many of us, but we are out there, like MCPHS. There are these 8-year programs. Is it tough? Yeah, but anything that's challenging is worth it. And that's why it's challenging, because the reward is far greater. Easy come, easy go. That's it. Anything easy in life does not have the value. Uh, the most treasured, the most valuable things in life are not easy to come by. That's why you have to work for them, but that's what makes them so valuable. It's tough studying, but life gets better. And it's very, very rewarding. So there are those 8-year programs like we have that certainly prepare students to go right out of high school straight through, just like in Europe and some other countries where you graduate from India and throughout Asia and throughout other countries around the world. You graduate and go into exactly what you're doing. Same thing in these pathway programs. Optometry is a 7-year program. When you look at other programs such as pharmacy, it's in the name and I should talk about it. And it's certainly, pharmacy is very, very, whoops, sorry, I went by, very, very popular. pharmacy, which is oftentimes a 5 or 6 year program, do pharmacists just dispense pills at Walgreens and CVS? No, they work in hospitals, or they work in pharmaceutical companies, or they specialize in areas like HIV, cancer, diabetes, pediatric oncology, nuclear pharmacy, ambulatory care, drug and research development, diabetes, pediatric diabetes. I have a freshman in the cardiac ICU at Mass General. It's a Harvard teaching hospital as a pharmacy student. I have a second year pharmacy student doing stem cell research through the Dana-Farber Cancer Institute. It's another Harvard teaching hospital. I have a student last year who did the year before last year, she did the summer undergraduate research fellowship through Harvard Medical. And in her senior year, in her final internship and research project, she was working with a group of scientists and doctors as a pharmacist um, at the Boston Children's Hospital. She was extracting DNA to find a cure for cancers and seizures. And this past year, she came home to Los Angeles and was doing her infectious disease medicine residency. I had to think about that at the University of Southern California, USC, fight on the Trojans. So that's what also pharmacists do. And I think when one is looking into pharmacy and looking to go into pharmacy, I think it's really important that if you were to ask, there's conversation out there, is pharmacy saturated? I would say if it is, I'm not going to say no, but if there was an area, it would be retail, which is Walgreens, CVS, although those are important jobs. If any area of pharmacy is saturated, it would be retail. But quite honestly, when you look at specialization pharmacy, which our school specializes in a lot of because of our location, let me see if I can pull this up. Yeah, here's Cambridge. So here's Harvard and MIT. Here's the Charles. Just kind of give you a snapshot. I keep referencing these places, so you're probably interested in where they are. Sorry about that. You cross the bridge. Here's the Charles into downtown Boston. Here's us. Here's Harvard Medical School. Here's Harvard School of Public Health, Brigham and Women's Hospital. These are all Harvard teaching hospitals. So as I threw those names out there, that's what these places are. They're Harvard affiliated teaching hospitals. So our kids are doing a lot of this is probably one of the most expensive real estate in the world, $30 billion in research and funding each year. It's pretty wild. But they do really important life-saving stuff. And so definitely, sorry about that. Hopefully you can't see that. Somebody just messaged me, but hopefully you didn't see that. Sorry. So pretty much that, because of our school, it provides our students with opportunities to go into specialized medicine. So and that's kind of where my presentation is going today, really focusing in on where the opportunities are in specialized medicine. When we look at pharmacology and toxicology, as you sit there, that's the side effect of the drug and how that reacts to the human body. Those are typically 4-year programs, and students go on to get a master's degree in that. Pharmaceutical science is the research side of pharmacy, pharmaceutical healthcare business and healthcare management. If I'm going into business today, I certainly want to go into healthcare business or pharmaceutical business simply because it's, again, the medical field, and it is not affected by a recession or a stock market crash or anything like that. So if one is supplying needles, bed straps, monitors, artificial hearts, pacemakers to hospitals and healthcare organizations, you're always going to have a job, right? You're not going to have to worry about what the market takes with it when it crumbles, because you're not going to be affected by that again. So you're providing solutions, equipment, technology, resources to hospitals and healthcare organizations all over the world, all over the country, in making sure that those places are well supplied in order to meet the demands of those things and treating their patients. So that's incredibly important. I think going into healthcare business, pharmaceutical healthcare business, global healthcare management are great areas of business to go into. Anything that is tied with healthcare. Oftentimes students ask me, should I major in biology and can I get to med school that way? You can, but just keep in mind, med school looks at prerequisite courses. You have to have prereqs. So with that being said, I don't know if I would choose biology. If you could choose like a pre-medical and health studies program, which includes advising, mentorship, internships, research, prereqs, that's going to be helpful. Biology, especially medical molecular biology, which we would find a program at a school like MCPHS, increases your chances within biology to get to med school. You'll have to add a few things. You'll have to add a few classes. It is a stepping stone there, but at a place like this or if you're really focused and serious, you might want to do a bachelor's of science to MD, aka a BS BSDO, or pre-medical and health studies, which includes the vising, the internships, the research, and the prereqs. That's incredibly important. You can go to Berkeley, you can go to UCLA, you can go to top-notch schools, but if you don't have prereqs, and you can have over a 4.0, you might not get in simply because you don't have the prerequisites required to get into med school. It's extremely important, and a certain amount of clinical hours. So that's really, really important. One bundle of pre-medical and health studies majors, which you see here, it includes all that. So that too is a launching pad to med school, vet school, and dental school. And certainly it includes all of those things, and practice on your interviewing skills, and practice a year-long study program on the MCAT, the DAT for dental school, the MCAT for vet school. But certainly it provides those things, and it's a better launching pad to go into those fields than just studying biology. If you do and end up majoring and enrolling in biology at a college or university, you have to be your own advisor, because maybe you have an academic advisor, but maybe they're only advising you on getting a degree from that institution. Maybe they don't have a medical background. So you may have to do your own research in terms of what you're going to need to apply and to be accepted to med school. That's another job on top of the job you have of being a student and get good grades and getting internships and those things. So I guess what I'm saying is find a pre-medical and health studies program or something focused to get you into on your way to med school. It's going to be much easier. Public health is a big issue today. There's a lot of mental health issues out there with everybody. The stress of the world today, the stress of the state that we're in, homelessness, unfortunately, drug use and abuse, alcoholism always. So going into public health, you're really helping and serving your community well by providing important services within the community. You can also be a public health administrator and making sure that the wellness and the environment of schools, of hospitals, of businesses are up to code and up to date. So people aren't breathing in toxic stuff, and making sure that our environment is safe and certainly not putting us in harm's way. So along with health psychology, we need those people today. As mental health issues continue to unfortunately rise up and cause harm among people, sad. We need healthcare psychologists. But what else do these people do? Well, they work in police stations. They work in schools, whether that's high school or colleges, universities. They have their own practice. They work in hospitals. They do a lot of great, important things to help all of us, and those of us and people out there that may be experiencing some tough times. So, these folks are incredibly important, and they're vital to society. And if that's something you're interested in, typically you would major in healthcare psychology for 4 years and go on and get a doctorate degree or PhD. Chemistry, we have a lot of students that go on and do a lot of research with Food and Drug Administration, with the government, with pharmaceutical and biotech companies. Oftentimes you want a 4-year degree in chemistry and then go on to get your master's degree, and then eventually your doctorate degree. Certainly health sciences is a good major if one is not quite sure what they're interested in doing, but they want to go into the medical field, and enrolling in health sciences, figuring that out is a great way before jumping straight into pre-med, not quite sure knowing if that's what you want to do, if you want to go on to med school. Majoring in health sciences is a great way and a great opportunity to just kind of explore the healthcare field and go about it that way. Dental hygiene. Dental hygienists do very well. They do very, very well in life. They don't want to be a dentist, but they want to, certainly provide service to patients. And so a career in dental hygiene is highly lucrative. And our graduates are employed immediately after graduating. Sometimes you'll see there a pre-dental to dental hygiene program. I think if you want to run your own dental practice, it's advantageous to get a degree maybe in dental hygiene, so you can hire a good dental hygienist when you're a dentist. So if also you're in the middle of losing a good dental hygienist to another dentist, you can fill in for them while being the dentist too. So you're serving more than just being the dentist, you're also able to do something else that is important. I think if you're going to run a dental practice, which is understanding what a dental hygienist does. The School of Nursing, nursing's hot, right? Nursing is really, really important. I see we got a question in the chat. I'll get there in a minute. Nursing is probably the hottest major coast to coast. With that, they're highly competitive because the job opportunities are there. I would apply to the direct entry programs. I would find them. Certainly a pre-nursing program. Don't waste your time. Just apply to the direct entry programs. In all of these majors in high school, you're gonna have to do well in biology and chemistry, algebra 1 and 2, geometry. Make sure, I know the UCs and Cal States now, from what I understand, students have to graduate with biology and chemistry. Amy, you can correct me if I'm wrong there. But you need biology and chemistry, and especially with the competitive and the popularity of nursing programs across the country, any one of those, do well in your bios and chems, your maths and sciences. Nursing is incredible, and the job opportunities are there. There were a lot of nurses that retired during COVID. We need them. We'll continue to need them. Our program is a direct entry 3-year accelerated program. They go through the fall, spring, and summer. There's not a lot of loss of knowledge from one year to the next, and actually they um, get an extra year of income because they graduate in 3 years as opposed to 4. Uh, DMS, or diagnostic medical sonography, MRI, medical resonance imaging, nuclear medicine technology, radiation therapy, and radiography, which is a 4-year program. It's under most of these are all 3-year. The School of Medical Imaging and Therapeutics, within that school, these jobs are highly lucrative. They're highly employable. Our students are graduating, doing very well financially, but they're actually doing things that are incredibly important. When you look at DMS, not only can, many people think of tracking, a baby's heartbeat in the womb of a mom, but let's say we're athletes and we tear our quad. They can take an iPhone looking like device, put it above the shorts or the pants, and they can see the tear in the quad. It's pretty incredible. MRI is utilizing nuclear medicine and radiation therapy to cure infectious diseases like cancer, along with nuclear medicine technology and radiation therapy and radiography. So they all focus in different areas, but certainly are there to all kind of focusing on the same goal, which is really to cure infectious diseases. Certainly, I'm going to get to we got a couple questions here. Let's get to those quickly. Amy's got it. Medical school, what you major in or what programs, internships you do. Also, what is the best gateway to go into medical school? I would look for a pre-medical and health studies program, or any type of program that provides internships, research, interview. One thing that medical school is really, really looking at, 20 years ago, they looked for sciencey based students. They really, really did. Today, they're looking for an equal, healthy balance of science, knowledge, intelligence, along with good communication skills, because at the end of the day, we are working with human beings, right? And we need to effectively, if I could talk today, I apologize. We need to effectively communicate with them. And with that being said, it's really important, and there's a lot of emphasis now put on the interviewing part of med school. So it's really important that we find effective communicators that are going on to med school and interviewing for med school. When you look at med school and you're looking at programs and you're trying to find the best route to med school, it's important to look for it's really, really important to look for these pre-medical and health studies programs, and programs where it does combine these interviewing opportunities, practice interviews, where it combines certainly internships and research, where it combines the prerequisites. You need those prereqs, because med schools are really, really tough on prereqs, and they have to be, because these degrees are all medically licensed by law. With that being said, I would, if you're going to go the biology route, I would go medical molecular biology. I would do that. That will be probably the best route to go biology wise. If it's if it's not pre-medical and health studies, I think just majoring in biology At a bigger university, you have to be very, very careful simply because, well, I mean, you're going to have to do a lot of work on your own. You're going to have to do a lot of outside of just getting all the courses that you need and making sure you get all the research and internships and certain amount of clinical hours and things like that. That's incredibly important. That I think a smaller school with a focus in health sciences is going to give you a greater opportunity at getting into med school because it's what it focuses on. A lot of just, for example, our students, their class schedule is already chosen for them. They can adjust it the first week of September. So, but as far as meaning if they're not morning people, and they're more night owls, well, they can certainly change the times and stuff. But as far as choosing their own courses, that's chosen for them. The internships are chosen for them. And then that schedule, that includes the prereqs. So those things are really, really important. And it's as the volume of applications for medical school increases, it's really extremely important that, picking the right program that kind of includes a bundle for you. So you don't have to do much outside of just following the script, uh, doing your coursework, following the internship opportunities that the schools provide to you. Those are the best way. Another question here. If you want to become a PA, what majors did you apply for? We have a 6-year pre-med/PA program where you're done in 6 years. Find those because you shouldn't take you. If it takes you longer than 6 years, you might as well go to med school. So that's a great question. We have a pre-med PA pathway, which is a 6-year program going to physician's assistant right out of high school. And PA is popular. They can perform surgery under the supervision of an MD or DO. They're not chasing down medical insurances to make sure the patient's getting billed by the insurance company. You're not on call 24/7. You're not doing any of those things. So, and there's a lot of people that don't want to go to school for 8 to 10 years. So going to school for 6 years right out of high school and being a physician's assistant and having a more 9 to 5, and in the long run, you make just as much, right? You're in less time. You're in school less time, so less loans, less paying back your school loans and what you paid for your tuition. You get a quicker return on your investment. You pay those off a lot faster, and you're rocking and rolling out of the doors, out of the gates. So, look for those like ours, those pre-med PA pathway programs, 6 years. Good question. I'll tell you a little bit more about MCPHS, and we'll open it up to more questions. This is kind of what I was talking about, just kind of used for examples. Like you can see the Doctor of Physical Therapy, 3+3. This is just a few. We have many. Doctor of Optometry or OD, dual BS to OD degree, 300 years of undergraduate, 4 years graduate. PA, 3+3, the one you just asked about. That's popular, and the best route because you're in and out in 6 years. 3 years undergraduate, 2 years graduate for occupational therapy. We're a small school, so MCPHS is typically a 17-to-1 student to faculty ratio, average class size, less than 20 students. Students, think of yourself as an academic athlete. You're surrounded by a peer mentor, a peer tutor, an academic advisor, a financial aid counselor. You're also surrounded by a plethora and a wealth of internships and research opportunities through Harvard Medical and their teaching hospitals. This is actually 118,000 now. And interprofessional education, AKA/IPE, is really important simply because, to give you an example here, our healthcare psychology students work with our pharmacy students and our DMS students, diagnostic medical sonography, to understand that, and certainly our dental students, our dental hygiene students. I throw in pharmacy because they are, if students so wish to do so, are able to give flu shots. To work with our students' psychology of those dental students, dental hygiene students, pharmacy students, and DMS, because if students so wish to do so, they go into under diagnostic medical sonography, imaging, and therapeutics. The psychology of a patient going into those procedures. We know the dentist office is going to pinch and pull and hurt a little bit. It just does. But understanding what we're thinking about before we go into that procedure is really important. So that's one area. That's one example of IPE. Boston is incredible. We have over 100 plus student organizations. We're a member of the colleges of the Fenway. So if you're interested in medicine, or you're interested in art, but you're going to be a pediatric PA, you can take courses for free, no additional charge at Massachusetts College of Art and Design, and certainly orchestra, theater, drama. On-campus housing, dorms have come a long way everywhere. We have suite style, apartment style, along with traditional. If you're interested in applying, it's free to apply, no application fee. We use the common application. We have our own supplemental application too as well, but most kids use the common app, no fee, high school transcript. Make sure you have biology and chemistry. That's a requirement. It doesn't have to be AP or IB, just have bio and chem. Essays, the common app has like several, choose one, and then we have a short answer supplement is why you want to become a healthcare practitioner. One letter of recommendation is required. Here are the deadlines: November 1, early action, not binding, November 1, December 1, early action 2, not binding, February 1st, regular decision, March 15th is the financial aid priority deadline, and May 1 is the candidate reply date. Modern technology has come a long way at most colleges and universities, especially MCPHS. You can track the status of your application by a username and password. You create an application portal, and once the decision is made, you will certainly see that decision before it comes home in the mail. When you're looking at scholarships, the presidential scholarship now is $18,000. By simply applying, you're automatically considered to be eligible for scholarships, and certainly maintain a 2.5 GPA and above, and you'll receive that each and every year. Return on investment is a big thing we talk about. Typically, our students' tuition is a lot lower than their salary, so they don't have debt. So if your salary supersedes what you paid to go to school for, you're not going to be in debt. If you paid $200,000 for a $40,000 a year job, you're going to have some debt. If you have questions, and I'm going to get to those in a minute, that's my information. You can certainly reach out to me at any time. Alan Beaudoin, ALAN.BEAUDON at mcphs.edu. You can reach me directly at 617-823-8276. I'm going to get to a qual. I'll leave that up in case you guys want to jot it down. How selective is MCPHS? I mean, we're selective, but basically we're more straightforward. We'll let you know, we're basically looking at your grades in biology and chemistry and your sciences. But this is something that you have to know as well. And I was always struggle to try and word this the best way I possibly can. And I think the best way to do it is this way. So I know when you look at our Cal States and UCs, for years it was high GPA and high test score. Is that going to work in medicine? No, it's not going to work in medicine, because the reality is this. Let's say I have a 4.0 and a 3.5, right? 3.5 over here, 4.0 here. And I put a muscle in front of each student. I spray it with bronchitis and mononucleosis, a virus. Then I add erythromycin and amoxicillin, an antibiotic. And then I ask, where does inflammation occur and why? Yeah, some people do very well on multiple choice exams. But when A, B, C, D, E, F, or G is not in front of them, when you have to practically apply knowledge to something in front of you and you can't fall back on that multiple choice exam or the A, B, C, D, E, F, or G, it's not there. You have to apply what you've learned and put it all together right then and there. Sometimes the 3.5 can get it right versus the 4.0. That's just practically applying knowledge to something, and that's medicine. So we don't base our decisions solely on GPAs and test scores. We're actually SAT, ACT optional. So since COVID. So with that being said, we're looking for a well-rounded student, one that has certainly done well in biology and chemistry and their sciences, along with good communication skills, certainly more balance. So I don't, and that goes for med school. A lot of the students that get into med school didn't have a 4.0. They are good students, but they can effectively apply knowledge to something and have those skills, and those skills are incredibly important. So hopefully that answers your question. Any other questions? I know that's a lot of information.
Always love listening to you.
Thank you. I apologize. There were some distractions. I don't know if you could see it. I had colleagues messaging me through Microsoft Teams here, and I'm trying to ignore it and trying to go above the noise. And there's some noise outside, so I apologize about that. But hopefully,
don't worry. Tell Samuel to cool his jets.
Yeah, I don't know what he wanted. I couldn't see it. Could you see? I don't know what he wanted to talk about, but sorry about that.
Don't even worry about it. Like, we had freshman orientation here, so it's actually quiet now, but other presentations, there was just like this hum of, but I am going to allow the students, if you have asked your question, it's okay to say thank you and sign off, because I know how to reach Alan, you guys know how to reach me. And, but I do want to share a cute story. One of our students, Christine Wynn, she's at MCPHS, and she brought back a stuffed animal for me, but she loves it there, and she calls Alan, she calls him my boy. I think that's spelled with an I. So I know that he really puts himself out there for the students and make sure that you are comfortable making an important decision. So thank you so much, Alan, for being here. And I always learn something.
I'm glad. I'm happy. Anytime. My pleasure. Sorry for the distractions. I didn't even know who was buzzing me. You said Samuel. It's one of our new guys, Samuel Lang. So he always reaches out. Everybody, when they're new here, reaches out to me for questions because I've been here since 2009. So I don't know what he wanted, but I apologize about the distractions and all the other noise. So my apologies there.
You don't need to. So thank you. Now, if you see any other questions, let me know. Otherwise, I'm just going to close it out.
Yeah, no, don't. I think we're good. Oh, there's one, two, couple in the chat. Thank you. You are very welcome. My pleasure, guys. My pleasure.
All right.
Anytime.
Okay. Thank you so much, Alan. And then sign up to come visit Prospect.
Absolutely. Will do.
Yeah, I can't wait. We're all in person again.
Thank God.
I know. All right. I'm closing it out.
All right. We'll see you soon.
Bye. Have a good one.
Bye, guys.